Dr. Rupa Shah, who's the chairperson of PAN Mumbai chapter, and we would be hearing from her about the metabolic diseases.
Have you all heard about this term, metabolic syndrome? So I'm going to talk on this. आप लोग देख रहे हैं screen पे, there is a cluster of conditions that are called as metabolic syndrome, or METS we call it as. Abdominal obesity, high fasting glucose, elevated triglycerides, low HDL cholesterol, and hypertension. All of these things together, we label it as METS. And the prevalence, according to ICMR study, is about 30 to 40% in urban India. And having metabolic syndrome X is going to increase the risk of type 2 diabetes, cardiovascular disease, stroke, and fatty liver. So here, quickly, I'm just showing you what is contributing to METS is prothrombotic state, oxidative state, stress, inflammation, again, all other things that I mentioned before, and then finally leading to all the different diseases that we name it as the end result of it. I just recently published this film.
Them containing a molecule called as IGF, insulin-like growth factor. The natural insulin in the body is not able to attach itself to that receptor and open up the receptor so that glucose can go in. And because glucose can't go in, the body secretes more insulin. And more insulin itself is the biggest problem in the body today, in every family. Because of this resistance to insulin and increased insulin, we are having overweight, because insulin kind of holds sugar, water, and fat, all of it together. It will stimulate the sympathetic nervous system and increase the blood pressure. It will go to the liver and create fatty liver, deposit more fat in the liver. It will make the liver produce more cholesterol. It will interfere with the liver enzymes such that the active hormone of thyroid is not getting converted properly, so hypothyroid will happen. It will interfere with reproductive hormones, creating PCOD, erectile dysfunctions, and others. It can also create sleep apnea and snoring and acidity. And major thing is deposition of plaques or increase of plaques in the heart arteries, brain arteries, thereby increasing heart attack and strokes.
So basically, insulin resistance and is giving rise to so many different conditions in our body, and we label it as different diseases. So here is a study that was done in northern India, Kanpur, and they found that females had higher prevalence of METS as compared to males, and on average, it was coming to around 40%. So, and the age group was 50 to 59 years. And so now you understand that this is quite a grave problem already because of such high prevalence. Now there are risk factors which are modifiable, which are listed here as poor diet. Of course, we can change. We have all these refined carbs, sugar, saturated and trans fats, and lot of processed foods, ultra-processed foods. Very sedentary lifestyle, screen time all the time, no exercise, weight gain. Then central, visceral obesity, the liver, having a lot of fat. Then smoking, all this is going to cause inflammation and oxidative stress. Of course, addictions like alcohol, which is directly leading towards hypertension and dyslipidemia. Sleep disturbances is also going to promote weight gain, as Dr. Rohit mentioned. And of course, chronic stress will elevate cortisol level, will cause central fat deposition, and leading to insulin resistance. Now, the non-modifiable risk factors are age. As you go above 40, chances of you getting METS are very high. So obviously you can't change this factor. Then there is genetics and family history. मेरे घर में सभी को diabetes है, तो मेरा भी number लगेगा. So that kind of genetics, very strong history. But later on we will also mention that how you can turn off your genes. There's a science called as epigenetics, where you can, though everybody in the family has it, you can choose not to have it, or you can even reverse it if you have it. And then finally, ethnicity. South Asians, we are also more prone to METS. The pathophysiology, the overview is like this. What it does, central insulin resistance, There is inflammation, that is TNF, alpha, and IL-6 causing inflammation. Adipose tissue is not functioning well. The gut microbiome is not in balance, and there is also oxidative stress. Now, what is the diagnostic criteria? How will you diagnose someone as metabolic syndrome? So these are the 5 different things that you see on the screen. This is a guideline that was given by National Cholesterol Education Programs. And so low level of HDL. HDL is the healthy cholesterol, right? Here is the number. The number says that men, if they have less than 40 reading, and women, if they have less than 50, then that is the criteria. The second one, your fasting blood sugar more than 100. Third, blood pressure 130 by 85. Excess weight around abdomen. Remember, the girth, okay? So that's your waist circumference. Men 90, more than 90, women more than 80. And then finally your triglyceride level, if it is coming more than 150. So now these are the 5 different things you measure. This is monitoring. And then if you find any of the 3 or more factors already crossing the line, then you label that person as metabolic syndrome. So looking at this, how many in the audience think that they might have metabolic syndrome? Quite a few. I can see many, right? Because we do get these tests done very routinely. But what do? We label them as 5 different conditions or diseases. Correct? And we have specialists for each one of them. There's a weight loss fellow, there's a heart fellow, there is a diabetologist. You go to different doctors, right? You take different drugs also. But this is, just name is only one, metabolic syndrome. There's also HOMA-IR index that we do. Here you take fasting insulin and fasting glucose. You multiply and then you divide it by a constant factor, 22.5. And if the reading comes more than 2.5, then you call it as a risk factor. Anything less than that is better. 1 is really good. So this is also suggestive. It's not a final number, but you can pay attention that even this is worth calculating.
One of the major reasons of dairy contributing to all these host of diseases, as we call them, there's something called the hydra plant underwater. It's got 10 heads. You press one head, another head pops up, and you press the other head, and the third head pops up, because internally all the 10 heads are connected. So is what I always recommend participants and families to look at: diabetes, obesity, hypertension, high cholesterol, hypothyroid, PCOD, heart attack, stroke, snoring, black necks, acanthosis, which is happening in young kids now a lot more. All of these are like 10 heads of the hydra plant. You try and press one with any one tablet. You try to have the hypertension tablet or the cholesterol tablet or the diabetes tablet. The other head is going to pop up after a few years. So some of them start with hypertension, some of them start with high cholesterol, some of them start with diabetes. But all of it is connected with high insulin inside the bloodstream, resultant of high insulin resistance. And one of the major reasons for insulin resistance rising is the IGF molecule coming from dairy.
This is taken from the recently released film, Reversing Diabetes. I just released on YouTube last Saturday. And this is Dr. Pramod Tripathi explaining that finally what we are doing is not handling the root cause, and you're trying to, take one medicine, maybe BP zyada hai, so I took blood pressure medication. But just by handling one symptom of the same disease, you are not going to, you are under the impression that you are doing something great, but other things will come up, And don't we have a very standard prescription these days? पहले 5 किलो वजन बढ़ा, ध्यान नहीं दिया. बाद में एक दिन blood sugar check किया, it was 500. Oh, I am a diabetic now. So then the diabetes medicine started, metformin. Then after about 3-4 years, now even the lipid numbers are bad. So doctor told me I must start a statin, third one. Then the fourth one, after about 15 years into this disease, you will have the next one. Which one? Blood pressure, right? वो भी बाकी है. तो blood pressure medication. उसके बाद और कुछ बचा है? Thyroid. If young women, 15, 16, it starts with obesity, PCOD, right? And then the cycle goes. So entry point can be any one of these. Finally, you will pick up all brothers and sisters on the way. Am I right? And what is a standard prescription? एक बीपी की गोली खा रहा हूँ, एक डायबिटीज़ की खा रहा हूँ, एक स्टेटिन भी खा रहा हूँ, और एक ब्लड थिनर भी अभी लगा है. और भी कुछ होते हैं ना, थायरोनोम भी आ जाता है. So this is a standard prescription. When about 16 plus years ago, I went plant-based, and my personal health benefits were tremendous. Then I started helping patients with reversing diabetes. And the prescription used to be almost the same. Every patient who came had all this, same prescription. So finally, I understood that there's something deeper than just diabetes. So let's go. And then I found that it is metabolic syndrome X, or we call it as insulin resistance. So now, our conventional treatment is always just so many different drugs, right? Prescription is very easy, drugs are available. There is also a problem of drug interaction, polypharmacy. वो सुबह उठ के एक आयुर्वेद की गोली भी खाता हूँ, उससे शुगर कंट्रोल में रहता है. Someone is also doing some other self-medication. So there is a lot of drug interaction, all those problems also there. And then what happens? You tell them a few things about lifestyle change, but because the drugs are giving a false sense of security, and you haven't changed anything in your own self, you become बेफिक्र, बिंदास. आज मैंने 2 गुलाब जामुन खाए, थोड़ा 2 यूनिट ज़्यादा मार लिया, like something like that, So it's pretty much like you just keep going on and on with the drugs, but not looking at the very cause of it. The root cause is completely ignored because we have so many different drugs are available for it. Isn't it true that we all are doing the same thing these days? Is it true? And we have doctors for all these different diseases they don't talk to each other, that's another one. Doctors don't talk to each other. वो मेरा heart का doctor इधर है, मेरा endocrinologist, they don't even talk to each other. They don't know what prescription. Yes. No, they say one very good thing. Sugar नहीं है. Sugar control में है. अरे तो दवाई ले रहा है ना. But are you treating cause or are you treating the symptoms? So is it scientific? आपके घर में अगर आप एंटर हुए और घर में बहुत सारा पानी भर गया है, आप पानी को ऐसा पोता मारोगे कि जाके पहले नल बंद करोगे? नल बंद करोगे ना. अभी हम लोग खाली पोछा मार रहे हैं. Correct. So that is the drug approach. Okay. So finally, the role of whole food plant-based diet in helping the metabolic syndrome. So every one of us can speak from different disease point of view. We all are trying to tell you the same thing exactly, is to come to the plant-based diet because it is going to help metabolic syndrome X, which has all these different disease conditions. So you all understood, a patient doesn't come just only for diabetes, right? It comes with all these iske bhai behan ke saath. So we have to help everything. So then sometimes they come and ask, oh, kidney wala diet do na abhi. But kidney, we don't do it like that. There's only one standard healthy diet which has to improve your numbers across the board. You all understand what I'm saying? I don't have to worry about potassium. I don't have to worry about raw foods, and I don't have to worry about the sugars and magnesiums and calcium. And we just do one standard whole food plant-based diet. There are certain rules to follow, and you'll find the numbers improving across the board. And that's so simple, right? It's so simple. You don't have to learn about so many medications. Every year, Dr. Mahendra Patel was saying that we keep learning about so many diabetes medicine. Almost every year a new drug is launched, right? Which is saying that the previous one had more side effects, and this one has less side effects, and somehow they convince us to start prescribing the new one. But has improvement has happened in our diabetes patient, complications, numbers have decreased, not even that. None of those things have happened. So whole food plant-based diet means already since morning you all are hearing, so I won't waste much time. Just read the last line. It is the nutrient-rich, fiber-dense, and anti-inflammatory diet. So quickly, I'll just say some research papers. This was done the impact of plant-based diet quality on the biomarkers. And they clearly found that when you do this, put the patients on this diet, they find that all the numbers improve. So very simple to know. And there is something like healthy and unhealthy plant-based diet. So just I want to tell you that plant-based diet, yes, but you are not going to take the colas and French fries because these are unhealthy. So when there is this H written, it's healthy plant-based, and when it is U written, it's unhealthy. So what we are talking about over here is only healthy plant-based diet. Please don't take the junk foods which can be plant-based, but they are going to contribute again to the metabolic syndrome. So just eliminate, go back to simple roti, sabji, dal, chawal, salad, simple plant-based foods. Eliminate all the animal products and all the processed foods. Simple, is that simple? And this is the study that was done where they compared the plant-based diet, but it has to be healthy, not unhealthy. And then they found that they have tremendous health benefits, and they also not only improve the numbers, it also helps in prevention of it. So do you all understand? I talked about two things, reversing and then prevention. Isn't that so good? Reversing, yes, obviously you have to come, iske sharane jao, you will get improvement. But not having it, as your age improves, increases, you will almost become like, sabko to ho raha hai, to mera bhi number lagega. But what if you don't? What if you choose to go on a whole food plant-based diet lifestyle, and then you don't invite those diseases? Isn't that so fantastic? You don't have to go to the doctors, no hospitals, no complications. And I think all of us have only one big desire, at least I have, is to have a great quality life. Kitni lambi jeevan hai pata nahi. Chalega, if I live till 100 also, I'm happy, but I have to be healthy. I don't want to be dependent on anybody. I don't want to keep saving my money. Kal hospital jana pade to kya hoga, paisa chahiye. Don't have to live in the fear because you've eaten clean, your numbers are good, you are very physically active, and you don't take any medicines. We have diseases, that is one thing. Then we have drugs on the top of it. So there are symptoms of the disease itself, and there are symptoms of the drugs itself. So you're trying to figure out two things, And then there is drug interaction. So things just go completely out of hand. But when you go on a plant-based diet, you start seeing all your numbers improving. What we do, in 21 days, we see cholesterol numbers just coming down. So we tell our patients, take your blood test, 21 days later, we'll repeat it. That's the first one, to improve so quickly. Now, this one particular study, they showed that women had more effect, so they found that, I don't know the exact reason why that happened, but the study found that higher adherence to a health food, remember health food plant-based diet, was associated with the lower risk of metabolic syndrome. Then this Dr. Pramod Tripathi, he published just one single study where he showed that his patient who had diabetes, who was also obese, they did the plant-based diet, obviously healthy plant-based diet, with some exercises and some lymphatic massage also. And then they found that he reversed his diabetes, he lost his weight, and what they call it as GTT. What is it? Glucose tolerance test. So diabetes goes into remission, reversal, do the GTT test, and then what happens if it is cleared, then he's out of diabetes. This is how. And so there are people who have not cleared just one time. Every year they go routinely for GTT. Every year it comes totally normal. So diabetes, remission, reversal, GTT clear many times. So you're out of metabolic syndrome. So this was a study that was done in South Korea. Again, South Korea has like very high incidence, much higher, so of metabolic syndrome. And so they finally did all these markers and then found that the very good quality plant-based diet definitely helped in the prevention of metabolic syndrome. Then, again, visceral fat and insulin resistance. This was a PCRM, Dr. Neil Barnard. They did the study. What they did, just sent out a questionnaire, and then they studied the dietary pattern, and then finally they concluded that all those who were on a low-fat, plant-based diet, obviously the healthy plant-based diet, their numbers were much better, and that intramyocellular fat and hepatocellular, that is liver, also the numbers improved, and also the insulin sensitivity improved. So, and then finally, this is just by the way, observation that in South India, they did some study and they found that sunflower oil was used quite a lot, and that contributed to the increased risk of metabolic syndrome. So again, processed foods are a problem. And then high fat, high saturated fat decreases the insulin sensitivity without even changing your fat in the abdomen. And then this is one more, the Adventist study that somebody already mentioned earlier. Also, they concluded with the data that vegetarians are having lesser incidence of metabolic syndrome. So they're divided into 3: vegan, vegetarian, and non-vegetarian. So a mechanism of action, very simple. It reduces insulin resistance, lowers your systemic inflammation. So we get CRP done. Those are the inflammation marker. How many of you get CRP done of your patients? How many? And CRPHS? Yeah, I usually get it done. I want to know. पूरा शरीर दुख रहा है. इधर touch करो, उधर touch करो. All this is inflammation in the body. CRP you should do. Gut microbiome is improved. Weight loss is very effortless, and it is also sustainable. And then finally, enhancing the endothelial function. Finally, the lifestyle medicine approach that everybody talked about, so I won't waste any time. Just want to show you one video from the my film, Reversing Diabetes. It's on YouTube. There's a card also outside you can pick up. QR code is there. Go home and watch it. So this particular patient was seen more than maybe 13 years ago. I don't remember. Just listen to her story. She's still totally out of any disease now. And she's sustained and thriving in her life as her age increases. Just see how it is done and how it changes the life. And this is how you can relate to the story, not only your own personal story, but all hundreds of your patients are exactly on the similar path, and they all can also do very well. Okay?
13, my diabetes was uncontrollable, and it was just not coming under control with any kind of medication and diet and everything. And the doctor said that I would have to be hospitalized because not only was my sugar very high, like my fasting sugars would be around 300, 350. My post-lunch sugars would be 500, 550. And my weight at that time was almost 100 kilos. So I think because of that, and because my BP was very high, it used to be 210 by 110, and the doctor said only two things can happen to you, lady. Either you will get a stroke or you will get a heart attack. And I didn't want both. I had severe hypothyroidism also. And once I went organic, I started eating organic, whole food, plant-based, and all three of them went. I lost about 30 kilos during my journey that time. And I started running the marathons. That was the high point in my life, where I couldn't even walk 100 meters without getting breathless and getting asthmatic and whatever. And now I was running 21, and on an average every day of 5 to 7 to 8 kilometers a day. So for me, this was changing my life. It was a life-changing experience.
So how do you feel listening to this one? Does that make sense? If she can do it, we can do it too, right? So very simple guidance on whole food, plant-based. She herself has become an expert now, and she teaches other people. Very simple, no sugar, no oil. no dairy products, and creating lots of recipes and thriving. These are just the names of the doctors who are in India or Indian origin. They are all plant-based, and also all the speakers today who were there in the panel discussion, and some more you will see. They are all plant-based doctors. Most of them are in Mumbai, and Shah, she's in Baroda. But across India, this is already happening. More and more doctors are joining. They are personally experiencing in their own life. So some of them, like Dr. Arun Kanyan Sundaram, he's from Chennai. He's a interventional cardiologist. Dr. Anil Singhvi from Indore, he's oncologist. Dr. Pawan Vadwan, he is a diabetologist. Dr. Rajendiran is in Coimbatore. He's also a cardiologist and doing preventive heart disease program. Dr. Ajoy and Jenny Prabhu, now of course they have gone back to US, but they are also helping patients reverse. Dr. Akhil Taher. So like so many, I myself have a group on WhatsApp where all the Indian doctors are there from all over the world who are learning more about whole food, plant-based diet and lifestyle. So basically, call to action, number 1, metabolic syndrome X, screen karo sabka. Okay, find out first. That is the most important thing. Khali diabetes, khali aisa alag alag mat karo. Do this. Recommend them the whole food plant-based diet lifestyle. Encourage a community base. So we sometimes do a potluck meeting where they all bring one food and we eat together, share recipes, and encourage each other. And then finally, educate them about the role of your lifestyle. You have invited your disease and you can reverse it. You must empower your patient. Drugs are only to be used in extreme cases where the compliance is not there. Just have a look at these books that I usually recommend. One is Dr. Neil Barnard. Second is How Not to Die by Dr. Michael Greger. His website, nutritionfact.org, is very important. The Starch Solution, and that's Dr. McDougall. And then China Study, Our Bible for Whole Food Plant-Based Diet. These are very important books. Then the films. These films are available on internet. Forks Over Knives, Maa Ka Doodh, What the Health, The Game Changers. Then the 2 films that I have released is Doctor in Me. The first part is Rethink Milk, and the second part is Reversing Diabetes. Thank you very much.